Welcome to the Daily Brief on Milwaukee's health and economy, brought to you by the Medical College of Wisconsin and the Metropolitan Milwaukee Association of Commerce. I'm Tim Sheehy, president of the Metropolitan Milwaukee Association of Commerce, and I'm joined by my co-host, Dr. John Raymond, president of the Medical College. Each day at 3:30, we deliver a fact-filled 19-minute update on the health and economic impact of COVID-19. And today we're going to be joined by Steve Wallace, who is the founder and president of Oman Sheehy Cocoa Bean Company, located in Mequon. And he's going to talk a little bit about his perspective of running a small business in the midst of this challenging crisis. So with that, I'm going to turn it over to Dr. Raymond for an update on the health perspective of COVID-19 for Wisconsin and the Metro Milwaukee area. Dr. Raymond?
Thanks, Tim. I'm going to touch on two topics today. The first will be our COVID-19 scorecard update, and the second will be a very brief discussion of potential vaccines for COVID-19. As you know, MMAC will provide you with a scorecard update each weekday, for which we'll share the number of new cases and the doubling rates of new cases incident here in Milwaukee and in Wisconsin. Now, earlier this week, we showed data that suggested that we were beginning to flatten the curve here in Wisconsin and in Milwaukee because our daily growth rates of new COVID-19 cases dropped from about 30% to below 20%, and the doubling rate of new COVID-19 cases stretched out from 3 to 4 days. Yesterday, the numbers showed doubling rates of about 4.1 days in Milwaukee and in Wisconsin, with daily growth rates of about 17%. Today, we had 123 new cases in Milwaukee and 199 in Wisconsin. The doubling rates have held steady at 4 days in Milwaukee and 4.2 days in Wisconsin. And the daily growth rates have held steady too, at 17.3% in Milwaukee and 16.5% in Wisconsin. So this is strong preliminary evidence that the social distancing interventions that were implemented on March 18th and Governor Evers' safer at home order on March 25th have begun to slow the spread of COVID-19 in our communities. But I do note that we have 199 new cases, and this is our largest single day jump in new cases in Wisconsin. So what does this mean for us? First and foremost, if the trend continues, it means that social distancing is beginning to work here in Wisconsin. But it also means that we can't relax. We actually have to do better. We need to redouble our efforts to slow the spread. The numbers of cases are still rising in Milwaukee and in Wisconsin at a very significant rate, and we expect them to continue to rise for weeks or longer. We still need to work hard to push the doubling times out past a week and maybe even past that, and we need to do so quickly before the capacity of our health systems to provide ICU care and ventilators will be exceeded. We could go to the next slide, please. I just want to talk a little bit about COVID-19 vaccines. There are about 30 to 40 companies now and academic institutions that are racing to create a vaccine. And 4 of those have moved from laboratory to animal testing, and 2 have moved to clinical trials, which is very helpful. We believe the greatest opportunities for rapid new vaccine development is simply to repurpose vaccines from similar viruses like the SARS and MERS viruses. Next slide, please. Just to talk a little bit about vaccines and what they're all about. The genetic material from SARS and COVID-19 are very similar. And most vaccines work by presenting a protein that's similar to the virus to the human immune system. And that vaccine then prompts the body to produce antibodies or an immune reaction that would cross-react with a pathogen or the virus. So you can kind of think of antibodies as an immune memory. We could go to the next slide, please. Now, the approaches in the past typically started with using live, weakened, or attenuated forms of virus. Those moved decades ago to using what we call recombinant vaccines, or proteins that are genetically made and produced either in bacteria or in animal cells. Lately, we are hoping to use tobacco or other plants to produce large amounts of recombinant protein. So it's important to know there are innovations that happen every year that make it easier for us to produce new vaccines in quantity. But still, all of these take time. Typically, it's a 12 to 18 month pipeline from when you start to develop a vaccine to when you're able to distribute that. And that's because you start under controlled conditions in a laboratory, you make the protein, you do animal testing, you do human testing and clinical trials. You need to go through an approval process. Then you begin to produce, distribute, and administer the vaccine. So even though we're probably not going to have a vaccine this year, I'm hoping that maybe by the end of the year, early next year, we can have one. And we can always hope for better. And certainly these new approaches might help us, but we really can't count on a vaccine this year. Tim, I'll turn it back over to you.
Thanks very much, Dr. Raymond. And I know we're talking about vaccines here. A couple current news items I wanted to get your reaction to as a doctor. The first was the discussion about Abbott Labs having, hundreds of thousands of tests, but nobody taking advantage of them. What's your response to that?
I think we have to be careful about capacity. Many labs have the capacity to do tests. If they don't have the reagents or the ingredients necessary to do the tests, they can't do them. So I don't think it's fair to say that there are labs ready to go that could do the tests in that quantity and they're being held back by regulations. Really, the problem is a supply chain problem.
Yeah, it's kind of half the story. The test can be ready, but execution of the test is another thing. Mm-hmm. The other kind of news that came out was the discussion, I think it was last night, from a national perspective, about a prognostication of the number of deaths, a couple 100,000 deaths particularly. And I know that for a lot of companies, this has sent out a chill amongst their workforce in terms of, is it safe to go to work? And you've mentioned this next 2 weeks is going to be challenging. So how do we unpack that news from your perspective?
Well, I know that the estimates were sobering, and if we don't continue to do social distancing in every state in the country, things could actually be worse than that. What I would tell employees, and what we're telling our employees here, is we're doing everything we can to minimize their chances of getting infected. And I think we need to redouble our efforts, not only to do screening and make sure that people are safe to come in the workplace, that we have an environment that is conducive to the social distancing, but that we educate and listen to our employees. We're going to have to reassure them.
Thank you. Thank you. So let me transition here to a discussion with our guest, Steve Wallace, again, the founder and president of Oman-Hini Cocoa Bean Company. Steve, you've been in business for 29 years. This has got to be one of the toughest years you've seen. So what are you doing as a small business owner to deal with this, for starters?
We're trying to keep the lights on it, and thank you very much, Tim. And let me just pause. I just wanted to say how grateful I am to you and all your colleagues at MMAC. You maintain a big and a very welcoming tent for both the largest employers in our region and the smallest ones, such as myself. So it's not an easy task. Thank you so much. As well to Dr. Raymond, your wisdom and your intelligence that you share with us every day is just an island of peace in these crazy times. So. Yeah, I started Oman-Hini 29 years ago. Classic small business. We produced hot chocolate drink mixes for the specialty coffee industry. We served the local coffee roasters and retailers here in Milwaukee and all over the country, as well as exporting to Japan. And while we do some online sales and serve some local grocery stores, we are primarily a B2B company. And we've seen our sales plummet as our entire customer base, all the coffee shops we love to frequent, are closed. They're shut down. So like many small businesses, I'm trying to keep my employees on the payroll, not simply to qualify for loan forgiveness, but because we want to restart quickly. And like many small businesses, we feel a deep responsibility for employees. And in fact, we believe the recovery, at least in our sector, food and beverage, will come back pretty fast. So let me just walk you through sort of the SBA experience that I've had over the last 2 weeks. You might recall Wisconsin had to apply for and be accepted into the SBA Disaster Relief Loan Program. It's a program that was primarily designed for hurricane and other natural disaster relief. This approval came on Monday, March 23rd, and I immediately started that online application. So funding was considered on a first come, first served basis, so time was of the essence. It took me 2 full days to complete that online application, and I probably spent 5 to 7 hours simply inputting the data and waiting for the pages to refresh. It was a very cumbersome process. There were no EFT bank numbers that were requested by the SBA, so the payment presumably was going to be affected by snail mail. Now, by Tuesday night, March 24th, the second day I had successfully submitted the application and I received a confirming email from the SBA. My application number was Wisconsin 72. So presumably I was the 72nd company in Wisconsin to complete the application 48 hours after the earliest time that was available. Now, this struck me as a really small number, but it was not entirely surprising given how formidable and time-consuming the application was. Just 40 hours later, however, on Thursday morning, March 27th, I received a second email from the SBA saying my application status had been changed from received to in review. So that was hopeful news, but I've not heard anything further. This Monday, seems like a lifetime ago, March 30th, the new streamlined SBA EIDL, that's the Economic Injury Disaster Loan online application, went live, became operational, and this is the vehicle that would provide the $10,000 advance funds within 3 to 5 days. Now, the website said it would take between 2 and 3 hours to complete the streamlined application. I probably completed the application in about 30 minutes or less. I had materials sitting ready to go. It was much easier than the previous application. The streamlined application, for those of you that take part, does ask for your EFT bank information. So the expectation is that the initial advance funds of $10,000 will be directly deposited into your bank account directly by the SBA. Now, the key information that you need to have ready is you need to have your gross revenues and your cost of goods sold for the 12-month period ending February 2020. So most small businesses operate on a calendar year, so preparing the information based on a March 1st, 2019 to a February 2020 accounting period may take a little bit of work. So while the grant is meant to be a quick shot in the arm, your business does have to demonstrate profitability during the last 12-month period. In other words, your revenues have to exceed your cost of goods sold. However, they don't ask for your sales and general administrative, your SGA expenses, just the cost of goods sold. So it's a pretty low bar to qualify, I would think. When you click submit, you get an application number. It was, mine was 10 digits long. So there's no obvious way of telling where anyone sits in the queue. Finally, my local banker confirmed that the next round of federal relief will come in the form of this new SBA administered Paycheck Protection Program, the PPP. Applications must be submitted by your local bank, not online, by an applicant themselves. So this last mile of funding will be locally delivered by a local bank, as opposed to direct deposited by the SBA. As of late yesterday, my bank and many others I've had a chance to just quickly speak with did not have details on the exact application requirements and the paperwork. That's something that's going to be determined between now and the next 48 hours. But things to do now, my advice would be, based on my previous 2 SBA applications, would be to gather electronic copies of your company and your personal tax returns for the last 2 years. Have a year-to-date personal financial statement ready to go. Have a list of your firm's monthly non-discretionary payables. That would be wages, rent, utility bills. Discretionary expenditures such as advertising, trade shows, travel are not likely part of the relief package, if not in the letter, but the spirit. And finally, have proof of payroll for 2019 and 2020 year to date. The purpose of these programs seems to be to keep people working, and you'll likely have to prove this at some point in the process. Thank you.
Thanks, Steve. I really appreciate that update. I know a lot of small business owners are in the process of going through this. And Steve's got a video that we've downloaded on coronavirus-mmac.org. And you'll find a lot of resources there to work through the CARES Act, the PPP application process, as well as other issues. Steve, let me ask you one question before we go to the audience here. What's the most important thing that you're communicating to your employees?
Well, I early on sat them down and we said we would endeavor to keep everyone on payroll through the month of April. That's what we could promise. And I think that settled people down. They knew, and I said sometime in April, we're going to have a discussion of what happens next. But we wanted people to know the sort of the best case, what they could be promised as a minimum, and then what the worst case might be should it come to that. So it was trying to be early and honest communication to just let people know that at least here going forward, this was already middle of March, the next 6 weeks, so that we were going to take care of them.
Thank you. Very, very helpful. Chris, I'll bring up Dr. Raymond's. We got questions?
Yes, we do. We had a couple for Steve and a couple for Dr. Raymond. Steve, one question is, with all this application process, have you actually seen any of this money yet, or is that still to come?
No, I haven't. So interestingly, the first round, not heard anything other than we're under review. The second one, the 3 to 5 days, that got in Monday night. So we've got Tuesday, Wednesday. I suppose the earliest I would hear would be tomorrow. I checked the bank account just before I came on this call. Nothing yet.
The other question for Steve was, this may not apply to you because your company's been in business for nearly 3 decades, but is there a minimum time that a small business would have to be in business to apply for this?
No, there doesn't appear to be, but you do have to, if you were ranked startup, and by that I mean, say, non-venture funded, you were thinking about starting a business, you have no real payroll because you're working on this evenings and weekends, that would not likely be the sort of thing. They're trying to look for at least some display for at least 1 year of actual cost of goods sold, gross revenues, and actual employment. So I suppose that would be the threshold, but there doesn't seem to be a length. You could be in business 1 year and qualify from how I read it, but I should say I'm not a practicing lawyer.
Very good. Also had a few questions for Dr. Raymond. Dr. Raymond, of the positive cases identified either in our region or in Wisconsin as a whole, is there any way to tell what percentage of people have been hospitalized?
It's a good question, and it's one that we're working with the Wisconsin Hospital Association and the local health systems to get a good answer for. We have had not that many hospitalizations up to this point, so I think the numbers wouldn't be accurate. But again, if you look at the information from other cities, 15% is a good rule of thumb for hospitalization, and half of those end up needing ICU care. We'll certainly update you on the local data as it becomes available.
Absolutely. One other question is asking about a trend in sales of alcohol that we've seen both here and nationally, which I suppose is good for our beverage producers here. However, there's also downside, obviously the potential for binge drinking and potentially even spousal abuse. Do you see that as a concern right now?
I think it's an obvious concern for all of us. And again, this social distancing is going to exacerbate strained relationships and make people that are already lonely feel more disenfranchised.
One other question is sort of an ethical dilemma. Somebody noted that their neighbor has just come back from overseas and the family has decided to self-quarantine. However, the family has also been seen leaving the house and having friends over. Is there sort of a public health policy opinion you can offer on what to do in this situation?
That's such a tough balance. I mean, we don't want to have a police state, but we really want people to comply with the guidelines that have been given because they're sound, and it's really the only tool in our tool chest right now is self-control and diligence.
All right, and thank you. Those are all the questions we see for now.
Good. Steve, Dr. Raymond, thank you again very much, both of you, for sharing your time. We'll be back on. You can see the schedule here on the screen. If you've logged on, all the slides are available also for you to download as a PDF. And we'll be back tomorrow at 3:30 for another edition of Milwaukee's Health and the Economy, brought to you by the Medical College and the Metropolitan Milwaukee Association of Commerce. Have a good, safe rest of your day.